This is Module 5, Activity 1, Question 1. I'm a new nurse in a hospital who's preparing to assist in the operating room. I observe the primary surgeon scrubbing for the surgery, and just before he enters the OR, he stops to sign some papers. How would I approach him? Potentially, I would walk up and say, Doctor, I noticed you are done scrubbing and you've just signed some papers. Would you like me to hold the team for a few minutes while you re-scrub since you signed those papers? And hopefully he would understand that I did see him and that he knows he needs to re-scrub. Number 2, I work for a tyrant of a doctor who has fired several nurses in the department. I see him make an error that might endanger the patient, but you're afraid to speak up. You need the job. What would you do? Well, when you're working in medicine, you can't just ignore something that could potentially injure a patient. I think it's far more important to approach the doctor and say, Doctor, I'm sorry, I see you made an error. Can I help you rectify this? What would you need from me to help the patient? And hopefully he would be enough of a good doctor that would recognize that and do what is needed to be done to help the patient. Okay, question number 3. I would be a doctor in a reputable hospital and work with a physician who you regard as incompetent in many areas. Would I speak to the doctor directly or opt to speak to my boss? And what are the advantages and disadvantages? I think in this case, I would speak to my boss and express my misgivings about this doctor and just say, look, I don't really feel he is correct for this particular surgery. I don't think he is competent to do what is needed, and I would prefer not to work with him. In my opinion, it would be the boss's position, I'm assuming he is head of surgery or head of the hospital, to manage that situation. And what are the advantages and disadvantages? Personally, I don't see any disadvantages. You're doing what you feel is correct to do on behalf of the patients. And, you know, if the other surgeon who you feel is incompetent is not qualified, you're still doing the right thing on behalf of your patients. And according to the medical Hippocratic Oath, that's what your focus is your patient. That's the most important thing. You take that oath that you're going to protect your patient at all costs. So I think the advantages far outweigh the disadvantages. If the guy doesn't like you afterward, too bad. You know, you're doing the right thing, and that's what matters. So I would approach the boss and explain it to him, and if the guy doesn't like it, oh well, you know. I don't know if the boss would get rid of him or not. I would hope that he would, but if he doesn't and the guy has an issue with you, again, Hippocratic Oath, that overweighs everything.